Our mission is to provide low cost, high quality health care to any individuals, any adults living in the Northeast Arkansas area that don't have insurance. But we also impact the community by providing volunteer opportunities for individuals who want to serve and do something. You don't have to be a medical professional to come and volunteer with us. We have individuals who do many things to support us. We have volunteers who serve on our board of directors that meet monthly to oversee the work that goes on at the health center. And then we have
Okay.
businesses that support us by giving their time, talent, and treasure, make an impact on the work that we're doing. Our biggest fundraiser of the year is going on right now, and I'd love to tell you about it.
Hello, and welcome to an episode of NEA Impact Giving Back. I'm your host, Dagan Davis, and today we have Michelle Lady. She's the executive director of Jonesboro Church Health Center. Michelle, thanks for joining us.
Thanks for having me. I'm excited to talk about the organization.
Yeah, and so that's really the first thing that we want to understand is what does Jonesboro Church Health Center do, and what's the mission behind it?
We are a Christian nonprofit organization that provides low cost, high quality healthcare to adults living in the Northeast Arkansas area who do not have insurance. So if you have insurance, you have availability of healthcare in other locations. But if you don't have insurance, oftentimes it's hard to find a place to go that's affordable. And so we offer that to individuals in the surrounding counties surrounding Jonesboro, an opportunity to come and get excellent health care at a very low cost for them to meet their healthcare needs.
Okay. Are there specific services that you offer? Are there limits to what you can offer? Where are we at on that?
So our organization provides primary care. We also have doctors who volunteer their time in specialty areas such as internal medicine, um, endocrinology, hypertension. We have a dermatologist now who comes in and provides service. And every visit that someone comes to the clinic only costs $25. So that is their out of pocket. If we run any labs, there is a cost for the lab, but those are reduced based on a donation from the lab organization by providing us services at a reduced cost. So we pass that reduced cost on to our patients.
Okay. Well, that sounds great. I know healthcare can get a little out of hand at some points. So, what is the biggest healthcare need that you see in this area?
Really, it's individuals that have chronic conditions like high blood pressure or diabetes that are not getting it seen by a doctor because they don't have the means to do so. And when you allow a chronic disease to go without medical intervention, it becomes emergent. And so we do our best to ensure that people know that we're here to provide the service so that maybe we can keep them out of the emergency room. That's our goal. And to keep them healthy by learning about the disease that they have and understanding how to treat it, and then being able to see a provider on a regular basis to manage that chronic disease.
Okay. When did you guys get started as an organization?
So we opened our doors in 1992. So we are 34 years old. And we were started by a community of really generous and forward thinking individuals who realized that healthcare, that there was a gap in healthcare for individuals that didn't have insurance. So this was in 1992. And if you think about it, nothing has changed in all these years. There are still individuals who don't have insurance. And so the healthcare they need, we need to provide. We were started by a doctor, Dr. Weldon Rainwater, a nurse, Flo Jones, and a pastor, Dr. Emil Williams. They brought community leaders together, almost 50 individuals, to start our organization. And interestingly enough, we still continue today, 34 years later, with the exact same mission and the exact same focus. We haven't changed in those times. Even though insurance has changed over the years, we still remain focused on individuals who don't have insurance because that has remained a constant since since the 90s. And so we're just really here to provide compassionate care to individuals who need it.
Yeah, and that's very true. Things are constantly changing every single year with healthcare, and that's amazing that since 1992 you guys have not changed a thing on people, and they know what to expect year in and year out, and in
That's
this
exactly
community.
right. And some of our providers have been around, for majority of those 34 years. And we have volunteer providers, we have nurse practitioners, we have a clinical staff that help us, meet the needs of our patients. We're open Monday through Thursday from 8 a.m. to 3:45 p.m. We ask that people, make an appointment if they can, but we will accept walk-ins if we have availability on our schedule.
Okay, great. And then are the original founders of the organization, are they still involved today?
Well, I'm glad you asked about the original founders. Actually, all of them have gone on to the great reward, and
Okay.
they're no longer with us on this earth, but they continue, their legacy continues through the service of their family members. Matter of fact, Flo Jones, who was the nurse, who was, a real trailblazer in this community. Her daughters still serve on our executive board and, make a huge impact. And the other family members, provide some, support in other ways, but the Jones family is a huge family, involved in what we do.
Okay. And then what's a common misconception that people may have to healthcare access?
So, first of all, I think people, have a thought that if someone doesn't have insurance, it's because they don't work. And that's not true. First of all, if you have a small business under a certain number of employees, you are not required to provide healthcare insurance. Secondly, healthcare insurance is expensive. And therefore, individuals sometimes have to make the choice to not pay for insurance. Maybe they've had an opportunity to have it at one point, maybe through a family member, that's working, and a family member loses their job, and now that they don't have insurance anymore. There are various reasons that people don't have insurance, but the biggest misconception is that they don't work, and that is furthest from the truth. We can give example after example of working individuals that just don't have insurance. And so that's why we want people to not feel, embarrassed by coming to our health center, because we're here to support and provide excellent care for them, just without insurance.
Yeah, and I can see how that label could be seen as negative, but it's really you guys are just helping the community out, and there's one thing where you could even be changing jobs, and you could be in between insurances for say a month or two, and you need to be seen, and a
That's
lot of people will just wait,
That's
right?
a great example that sometimes those things happen, and just like we mentioned with chronic illnesses, you definitely do not want to wait. If you're having issues with high blood pressure or diabetes, those things need to be dealt with. I can tell you in the last couple months, we've had one week in particular where we had 3 patients who came in to see us, and they had delayed seeing a doctor, delayed seeing a provider because they just thought they would get better. All 3 of those individuals had to be admitted to the hospital because they were severely sick. And, I'm glad they came in to see us and that we were able to get them in to the hospital to get them taken care of. But you can understand how those things can really creep up on you if you don't get care. And so it's a great example that somebody might be between jobs, and in that in between they don't have insurance, we still will see you if you don't have insurance. Then when you get insurance, you can go back to your primary care provider, but don't miss the opportunity to get care just because you don't have insurance.
Yeah, it could be a lot more important than you think. Definitely.
Absolutely.
So your clinic or your organization is really bridging the gap between what we were just discussing, having insurance and not having insurance. And so are you guys working with local businesses as well or just individuals to make sure that everyone's getting seen?
So, opportunities like this, certainly to get the word out, is really important. And Swept Away is an incredible partner of ours. And so we appreciate that they recommended us for this time to be able to come on and talk about what we do. So word of mouth is really important. Businesses knowing about us and informing their employees. I had an HR director at a company that provides insurance reach out to me and say, sometimes people through various reasons choose not to get health care when they become employed by us, or maybe they don't realize the timing of how, quickly they have to make those decisions, or they miss an open enrollment period for various things. How can you help us? It's like, well, of course, let them know about us so that we're here to care for them and bridge that gap in between the time that they become employed or they're waiting to be employed until the time that their insurance kicks in. So we're here for we're here for everyone that meet that need. If you have insurance, although we provide excellent care, you'd probably love to see our providers. We don't want to duplicate service. So children always have access to care somewhere. Adults don't, and so that is why we focus on adults without insurance.
Okay. Well, that's great, and good to mention the children as well. They always have all the opportunities, which they should. But when it comes to adults, they need the help too. Maybe even more sometimes.
Well, it's true because some things like type 2 diabetes and high blood pressure tend to manifest themselves later in life. And I've got a great example of a patient who has been a patient here for years, but he wasn't. He's a business owner. He owns his own business. But it's just he and his spouse who do the work of their business. And he went to a health fair that St. Bernard, one of our sponsor, St. Bernard's, was putting on, and they informed him that he had really high blood pressure, and they were concerned about him, and they said, "You really need to go to the doctor," and he said, "Well, I don't have insurance. I'm a, sole proprietor, just don't have insurance." And they're like, "Well, go to the Jonesboro Church Health Center. That's what they're here for." And he came to see us, and we've been managing that high blood pressure for several years now, and he's doing well as a result of coming into the clinic and seeing our providers.
That's really cool to me that other healthcare providers are also sponsoring you guys as well.
That's exactly right. St. Bernard's, we are adjacent to their property, and they actually own the building that we're in, and they provide us an extremely reduced rate for rent. We couldn't operate if we were fully paying for rent and all the things that go about maintaining, a facility like this. And then NEA Baptist is a huge supporter as well. Both hospitals understand that if we can care for a patient before it becomes an emergency, then that the patient will be better off, our community will be better off, and emergency rooms won't be filled with individuals who could get care in another facility. And so it's an important partnership that we have with both NEA Baptist and St. Bernard's.
Yeah, so you're really preventing future emergencies
That's
in
exactly
essence.
right. And so think about emergency rooms being used as primary care providers. What that does to your community is it elongates wait times in the emergency room. And when you need to be in an emergency room, you don't need to wait. You need to be seen quickly. And so, you don't want the system to be clogged up, for so to speak, by individuals that could get care in another facility.
Yeah, and I want to kind of circle back around to the cost of your services coming in to the facility, and so I know I've done it. I think every American has done it. You are worried about the price tag, and so you don't go in, whether it's emergency room, whether obviously if it's something life or death, you got to get it taken care of, or it's something in crazy pain. But if it's something that can be, you can maybe get over it, or you even think that you have the chance that okay, I'll get better after a few days. You're delaying that, like you were saying. And so with your facility, if someone comes in, obviously you want to try to schedule an appointment, right? But if they have to come in, either way, they're spent. I think you said $25 was the cost of the service.
That's right, it's $25 a visit, and so you know that on the front end. You don't you might not know what you're gonna be diagnosed with and what the cost on the what the additional cost could be as far as medications, and we work with our local pharmacies to try to get reduced rate. We always focus on generic drugs. We help our patients find the cheapest alternative when a drug is needed. But here is $25 and anything else that it's gonna cost you, we're gonna tell you up front what that cost is gonna look like or what we assume it will be so that you know in advance. But to know that you're walking in and it could only cost you $25 plus whatever medication, if labs need to be run, what that's gonna be. It's nice to know that you can get in and out for that amount. Whereas when you have insurance, you typically know your copay, but sometimes those copays are really high. And so, being able to know $25 is your amount to enter the facility is really, it's a good thing to know. And if someone is really having some severe challenges with their financial situation, we're going to do our best to work with them because we want them to be seen. If they're coming in and they need that care, we want to make sure that we're taking care of them.
Yeah, there's no way someone should not be seen for even if it's a financial situation. So yeah, that's great that you work with them on that. And like you said, it's just great to get this out there. And so hopefully many people in the community can see this episode. And that's why I was trying to dig into the pricing a little bit more to kind of give them a little more transparency.
Yep, absolutely. I think that's really important in healthcare transparency and what things are going to cost you. It's one of the few services that you get that you don't have that information.
Well, Michelle, we're going to cut to a quick commercial break and then we will be right back.
Swept Away is a professional, commercial, and industrial cleaning service.
We are locally owned in Jonesboro, available to all of Northeast Arkansas.
We are a reliable company available 24/7.
So if your business needs floor care or carpet cleaning,
We'll make it happen.
Visit our website for a free quote or give us a call at 870-340-8533 and we'll make it happen.
We'll make it happen.
All right. And we're back to our episode of NEA Impact Giving Back. We're here with Michelle Lady. She is the executive director of Jonesboro Church Health Center. Michelle, again, thanks for joining us, and we'll jump into our next segment here.
Well, I'm really thrilled to be here to talk about the Jonesboro Church Health Center and the volunteers and the community that supports us.
Yeah, and that's great. And that's what this show is all about. We want to really put it out there of what's going on, how each organization and company and leaders are helping the community and giving back. And so that's why we have it right in the name of the episode of the show. And so one thing I do want to know is outside of the healthcare facility, how is Jonesboro Church Health Center helping or trying to make a difference in the community?
Well, we have a very singular focus. Our mission is to provide low cost, high quality healthcare to any individuals, any adults living in the Northeast Arkansas area that that don't have insurance. But we also impact the community by providing volunteer opportunities for individuals who want to serve and do something. You don't have to be a medical professional to come and volunteer with us. We have individuals who do many things to support us. We have volunteers who serve on our board of directors that meet monthly to oversee the work that goes on at the health center. And then we have businesses that support us by giving their time, talent, and treasure to, make an impact on the work that we're doing. Our biggest fundraiser of the year is going on right now, and I'd love to tell you about it.
Yeah, yeah, sure. We'd love to hear about it.
Okay, so every year for 34 years, this organization has sold a crate of peaches directly from the grower in Georgia. They come overnight on a refrigerated truck that we go to, they go to Swept Away. I'm sorry, they go to High Troll, and volunteers from Swept Away and High Troll and great community leaders at many of the local banks come in and help us sort the peaches, sort the crates, and we hand deliver them to people's homes for everybody that has purchased um, a crate or multiple crates. Many businesses purchase multiple crates of peaches that we deliver to them. So for $125 a crate, you can get some fresh Georgia peaches delivered to your door sometime in early August.
Okay. That was gonna be my next question. When does that, delivery happen?
Yeah, so
So
we're
early August?
the sale is going on now, and we
Okay.
only get the number of crates that we sell in advance. So the sale's going on now. You can go to our website, that is jonesborochurchhealth.org, and we've got a page, actually a landing page dedicated to peaches, so you can go to there and place your order. You can also go to our if you can't find our website, you can go to our Facebook page, and it's Jonesboro Church Health Center, and it will link you back to our website and allow you to go in and order peaches.
That's awesome. And one thing that we'll do for you in addition is under the video here will be released on YouTube. So under the video, you'll see in the description the exactly what you were just explaining. So we'll make sure the landing page is there for the fundraiser. We'll have your website and everything detailed out.
That's awesome. Yeah, we want everybody that wants peaches to order them. Now, I hear sometimes you can purchase peaches for less at the local grocery store, and you can. That's not the point. The point of this is it is a fundraiser, and a percentage of the amount spent is an actual tax donation to the organization. And so anyone can show that tax donation on their taxes if they choose to do so.
Great. Yeah. So you're not only getting probably great tasting peaches. I've never had them, but if they're coming from Georgia, they're probably pretty good. And then you're also being able to give back to the community yourself. And that's, the whole thing here with NEA Impact that we're trying to promote is just giving back to the community.
Well, you're gonna have to order peaches because these are the best in the business. They come directly off the trees in Georgia, and they come overnight here. So they're not sitting, in a warehouse somewhere for any length of time. They are in a refrigerated truck, delivered here overnight, and on your doorstep the next morning.
Yeah. Nice and fresh.
Yep, absolutely. And they are delicious. They really are. I don't know if there's anything better than a Georgia peach. I'm a Southerner, so I really do love Georgia peaches. They are wonderful.
I honestly don't know if I've ever had one. I don't think I've ever had a Georgia peach, at least that fresh before. So
Yep,
that's
they
exciting.
are wonderful right off the tree. So, yep, you're gonna have to get some peaches. We'll make sure that you're on the list.
Okay, great. And so, one thing I wanted to dive into is, I wanted. I know you gave a little bit of an example earlier on, like a patient success story. Is there another one that maybe really stands out to you in the past that you can really explain to people that shows the impact that you guys can have?
So we had a patient come in not too long ago who was having some issues that it just didn't make sense. It was, and I can't go into a lot of detail, but it continued. The individual continued to be sick, continued to present in some ways that, um, you might think it was a cold. I'm sorry. You might think it was a cold or something going on where where their lungs, where you were seeing some issues, and we continued to dig into it to make sure that we were. I'm sorry, I gotta take another sip.
No, no problem.
To make sure we were really seeing what was going on with that individual.
Okay.
It ended up that we needed them to get to specialty care, and the individual um, has a serious diagnosis now, but we didn't stop, and I think that's what's really important to know. Our providers are they're really incredible. The amount of energy that they give to our patients. A lot of times you go to a doctor now and healthcare's become somewhat of a production facility. They have so much time between patients and they're constantly, moving quickly to see patients because healthcare is, something that everybody needs. And so there's a great need there. We really take the time. And so if a patient visit is more than 15 minutes, it's more than 15 minutes. That's just reality. We're not watching the clock. I'm not saying that others do, but I mean, we really are focused on getting to the end result. And our providers care. They really do. They have a passion for what they're doing. The doctors come here and they volunteer their time. And so for them to do that really speaks to who they are, and it speaks to the facilities that they work for. St. Bernard's and NEA Baptist both allow them to come here and donate their time and service in support of the community. So it really speaks to the healthcare community as a whole.
Yeah, that's amazing. And I know, sometimes you can be in a doctor's office and you kind of feel that clock presence, right? They don't say it, they don't, but you have to understand it is a business. They have to make money at some point, and so it can get a little rushed to see the next person, or there may be a time limit that you don't know of. But that's amazing. First of all, that you have volunteers from other jobs, other organizations that come in and help you guys. And then on top of that, you like you said, you're gonna get to the bottom of it. You're gonna figure it out. If you guys can't figure it out in your facility, you're gonna get them the best care possible within the situation and make sure that it's taken care of.
And that's happening in every health clinic in the area. So I don't want to think I want someone to think that it's not. But just because it's low cost, it still can be high quality. And I think
Right,
that's
right.
the real point here is that we are providing a high quality product, even though we're not charging a lot for it because we understand sometimes you have to go the extra mile for the patient and for the situation.
Yeah, yeah. And that's great to know. So, how important, probably one of my last questions here is how important is small business in the area to what you guys are doing? I know there's volunteer opportunities. There's also support opportunities. So, how important, if a local business is watching today, how important is it that they get involved with you, or at least give you a call?
I mentioned High Troll as a sponsor and St. Bernard's and NEA Baptist, and all of those are really long-standing large organizations. But Swept Away is a newer company, and they are leaning completely into this community in many, many ways and supporting us in their work. We've got family members who serve on committees, on the board, and they're sponsoring an exam room here in our facility. Small businesses really are a huge part of who we serve. Like I said, sometimes if your business is small, you don't have to provide insurance, or maybe you can't afford to. And we want your employees to know that we are here to provide service to them. At the same time, a sponsorship opportunity is really small in our health center. If we have a company that gives us $1,000 a quarter, we'll put your name on the wall and show that you're here, let the community know that you're supporting us. And so there are small ways through volunteering, um, which is a big way, or small gifts. $50 makes a difference. $50 takes care of 2 patient visits. So anything a company can do really will make a difference. I would invite every company in the community to purchase a crate of peaches and give them to their employees, if nothing else. I mean, $125, to get something in return like great peaches is a great thing, and maybe you could have a competition in the company of who makes the best peach cobbler, or, brings the best peach recipe in after getting the peaches given to them, given to the employees. So there's lots of things you can do to support us. Get the word out, make a donation. It always makes a difference.
Well, that's great. And then the importance of leadership in the community. I know you're a leader in the community. You obviously are involved with a lot of leaders in the community. So not only the small businesses, but the leadership is very important. And so, do you have any words for the leaders in the community?
Well, I think leadership is really about showing up every day, paying attention to what's going on, and getting involved, right? And knowing what's going on with your team, knowing what's going on in your company, knowing how people maybe need support that they're not articulating. I think people are incredibly resilient. And what amazes me in all the communities I've lived in throughout my life is I see wonderful people who care about their community and do what they can to serve. And I would say to any business that has the opportunity to allow their employees to serve in some way, it really does make a huge difference to the employees. It makes a difference to the morale of the company as well.
Yeah, that's very true. I've worked for companies that do not require any volunteering. I've worked with companies that they require a certain amount of hours per year that you have to volunteer, and the morale is a big thing, and the company culture, right? That's the biggest part. And seeing a lot of the companies, the small businesses and the large businesses in the area that are doing good things. And I mean, we'll probably have a lot of them on this show just because there's so many of the companies that are doing the right things. And so, yeah, if you're not doing anything, we'd love to have you get involved in the community. You can reach out to us. You can reach out to Michelle here. And Michelle, I really want to thank you for coming on the show here. This means a lot to us, means a lot to Swept Away, and we're just really, really happy to have you here.
Well, I appreciate the opportunity. Anytime I can talk about the Jonesboro Church Health Center, it's really a blessing. It's a great organization, 34 years in serving the community. We've got some exciting things planned for our 35th anniversary next year, and really some incredible legacy things that are going on to help us serve the community for the next 35 years.
Well, that's great. And so that'll do for another episode of NEA Impact Giving Back. Thanks for joining us, and we'll see you on the next one.
Swept Away is a professional, commercial, and industrial cleaning service.
We are locally owned in Jonesboro, available to all of Northeast Arkansas.
We are a reliable company available 24/7.
So if your business needs floor care or carpet cleaning,
We'll make it happen.
Visit our website for a free quote or give us a call at 870-340-8533, and we'll make it happen.
We'll make it happen.